Hello, I'm Richa Vakil, and my research partners are Marty Nyarko and Libin Vadian, and our research faculty is Dr. Vicky Pardo. We studied the effects of isometric training on the NUSTEP in patients with chronic stroke. Due to COVID, we were unable to carry out our own study on patients. However, we analyzed and looked into retrospective data collected from last year's NUSTEP transit study. A stroke causes damage to the brain from interruption of its blood supply and is the leading cause of disability in the U.S. One of the most common disabilities from stroke is hemiplegia, which is paralysis affecting one side of the body. The NUSTEP is a recumbent stepping machine that combines a natural sitting position with stepping motions. Recumbent stepping is beneficial because it can provide an effective cardiovascular workout for all major muscle groups while in a comfortable position. The NUSTEP Transit is a newer model which additionally has force plates in the foot pedals and a Samsung tablet with various settings and games that can be used depending on the patient. Currently, there are many studies that have investigated the use of virtual reality or visual feedback training in patients with stroke. These studies found many improvements in the stroke population, such as force control from increased activity in the visual motor network, cerebellum, and primary motor cortex, increased mobility level and physical performance, enhanced weight distribution ratio, better dynamic balance, and increased overall balance and independence of ADLs. Solov, Zahir, and Ferris in 2007 found that walking and recumbent stepping have similar neural networks due to the similarity in muscle activation factors and patterns, showing that recumbent stepping can improve gait. There is a lot of research on recumbent stepping in general, however, there is limited research on the lower extremity in isolation on the NUSTEP transit. Due to stroke affecting one's muscle tone, strength, and balance, it is important to regain those specific measures in order to retrain an effective gait pattern. This includes training isolated leg movements and gait velocity. In a study by Page et al. In 2008, they found that NUSTEP training improves balance, motor, and sensory impairments.
Here are the patient demographics from our study. It included 20 individuals from ages 18 to 90 that had a history of stroke greater than 6 months. Exclusion criteria included those with a history of bilateral stroke, musculoskeletal, neurological, cardiopulmonary, or respiratory conditions that limit their ability to perform recumbent stepping. Additionally, anyone currently receiving physical therapy treatment was excluded from participation. A total of 10 visits per person was required for participation in the study. Visits 1 and 10 consisted of pre and post intervention assessments, while visits 2 through 9 consisted of isometric training on the NUSTEP transit. The outcome measures selected for the study were used to assess gait parameters, lower extremity strength and endurance, balance and coordination, stroke recovery and sensation, and lower extremity functional ability. Each intervention session included recording patient vitals, a 5-minute warm-up session, 35 minutes of the paddleball game intervention, and 5-minute bouts, and a 5-minute cooldown. The isometric training portion required participants to perform isometric contractions of their lower extremity while in the seated recumbent stepping position. Each paddle on the game was controlled by the isometric force of the corresponding lower extremity, where pushing the leg down caused the paddle to go up and pulling up on the foot strap caused the paddle to go down. As the ball traveled back and forth, the patient would have to control the paddles to keep the ball moving in a manner similar to the game ping pong.
There were many significant findings, each of which are denoted by the red asterisks on these tables. We found significant changes in the lower extremity Fugl-Meyer assessment, 5 times sit to stand, 4-step square test, lower extremity functional scale, and 6-minute walk test. The only MVC change that was significant was knee extension on the hemipersonal side. Significant changes were also observed in both fast and normal gait speeds. For the fast gait speed, there were more significant changes in step and stride length on both the hemi and non-hemi lower extremities, as well as overall gait speed and double support time. We used descriptive statistics for demographic information. Independent t-tests or Wilcoxon-signed ranks tests were then used depending on the normality of the data, as determined by the Kolmogorov-Smirnov test for normality. As mentioned before, significant changes were found in both normal and fast gait for our participants. It is worth noting that the patients with hemiplegic gait following stroke typically walk with decreased speed, decrease in asymmetrical step length, decreased stance, and single support, lending to an inefficient gait pattern. Therefore, the improvements made in the spatiotemporal gait parameters may enable a safer and more efficient gait pattern. MDC values were found in the literature and compared to the outcome measures used in the study. When looking at these results compared to the MDCs, there was a significant amount of participants at 60% who met the MDC for the 5 times sit to stand. Also 30% met the MDC for the modified 4-step square test, and 40% met the MDC for the traditional 4-step square test, although it was from another population. 20 to 35% met the MDC for fast gait speed, and 25% met the MDC for the 6-minute walk test. This study demonstrated the addition of visual feedback during recumbent stepping and had significant and clinical relevant effects in individuals with chronic stroke. The changes observed in both normal and fast gait suggest an overall improvement in motor control. The improvements observed in the performance of the 4-step square test and 5 times sit to stand suggest improved functional mobility, coordination, and balance. The improvements observed in the lower extremity functional scale, Fugl-Meyer assessment of the lower extremity motor, and lower extremity MVC suggest improvements in lower extremity strength and function. And the changes observed in the 6-minute walk test scores indicate improved endurance. All these improvements may ultimately lead to safer transfers, decreased fall risk, and improved gait and functional mobility in patients with chronic stroke. These are the references that we utilize to help develop and guide our research. We would also like to acknowledge all of the study participants as well as the funding received by the NUSTEP LLC. Thank you.